All right, thank you. I'm going to call the meeting to order. I'll remind everyone to please disclose of any pecuniary interests at the appropriate time. And the third item on our agenda is the Board of Health Medical Officer of Health update on COVID-19. Is our Officer of Health with us today? I don't see. There they are.
There they are.
I'm going to turn it over to you guys.
Good morning. Can you hear me?
Yes.
Not too well.
Not too well. Can we turn it up a bit? Okay, I have a quiet voice, so I need all the amplification I can get.
Sorry, Jackie Margaret has her hand up.
Yeah, Margaret, do you have a comment?
Thank you, through the chair. I cannot see anybody in the room. I think I see 4 people. I mentioned this before. I think it's really important that we can see who's speaking and be able to watch what you're saying, but we can just see 4 very small dots.
Moved up to the useless table.
Well, I can stand in front of the camera, but if you want... That's what I want.
Just roll.
It is the sound is a bit muffled as well, so maybe for a future meeting we can rectify that.
I was just doing a meeting off of a desk, so that works better. But this is the setup here. But let's see. And part of this is support to me because, as you know, I'm temporarily here, so I don't have all the fine details maybe, and so this was to help if there's some question I can't deal with. I deal with the principles. So should I carry on?
Can everyone understand him? I'm hearing a lot of echoes, but I think I can.
I agree, through the chair. It's very muffled and it's not very distinct, but let's try. Let's see how it goes.
Thank you. Go ahead.
Do you want me to go back to a desk and talk to you, or I'll try it from here?
Okay.
There is fine.
Dr. Greensmith, from this, I don't know about everyone else. I'm not having any difficulty at all. And I can see you clearly.
Well, I'm at your command. I'll try it, okay? And then,
As best you can. Yep.
So the cases for this, for today or this week, we have 4 new cases and a total of 30 active cases in the community. We've had a total of 69 deaths. We've had a total of 545 variants of concern. 88 of these have been the Delta variant. And all 22 of these in the last 30 days have been Delta variant. And that's concerning because this is the more transmissible, more virulent version of the strain of the virus that started last year. This is now the 4th. Well, there's a number of different strains, but this is the one that's presently circulating here, and this is the one that we're worried is going to give us a 4th wave. And we are seeing rates higher in other communities, particularly Windsor, Essex, and Chatham, Canada, the highest in the province. And Chatham has a couple of outbreaks in its hospital. So our incidence rates at the moment are relatively low compared to them, but we'd hope that that would last, but we can't expect it to last. We expect we will trend up. We've been followed other health units a few weeks later. So it's just who's infectious, who's susceptible, they're going to get it. So because this is quite a transmissible virus. So in trying to prevent that, we're obviously in the vaccine business. We've given 170,246 doses. Amazing. So 79% of the population, 79.3% of the eligible population over 12 has had one dose, and 73.7% over 12 has had 2 doses. Since the announcements from the provincial government about vaccine passports and mandates, our clinics, we've given a lot of extra first doses. We had given 1,838 doses in the first 2 weeks of September, the first time doses, rather than walk-ins. We're still not to work on that. We have mobile clinics going out. Our lowest rates are in the population under the age of 40. We have very high immunization rates above 60 to 69, but it tails off the younger you get. And obviously children under the age of 12 are not yet eligible for the vaccine. So we're pushing, encouraging people to get the vaccine, safe, effective. It's available from us, it's available from pharmacies, and we hope it's available from our walk-in clinics, and we're working with primary care to have more providers there. There's a third dose recommendation for some people now. The confusing thing about this is it's not regarded as a booster, it's regarded as an enhancement for those who perhaps didn't respond well enough to the first 2 doses. So, and that's changing as we speak. There's a very select number of people with hematologic cancers, stem cell transplants. It's severely immunocompromised, who maybe didn't respond properly to the first 2 doses. The recommendation from a science table is to give a third dose. And we're working on that. We're asking for referrals from, we don't know who those people are. So we're asking for specialists or the treating physician to send them with a note. We have a form on our website which is being updated as well. We've had some walk-ins that have been turned away because we don't know what their eligibility is. That's changing. Late yesterday, there was they broadened that criteria for the immunocompromised a little bit. We need to clarify how far they broadened it, honestly. And that'll be on our website, but it's still on the same basis of getting at the immunocompromised, be it through disease or treatment of their disease. So, and the other group in need of third dose are those in residents in nursing homes and retirement homes now. And we're working with them. Hopefully they can give the vaccines themselves, but we can support them if they can't. So you'll be aware of the vaccine passport initiative from the provincial government. We are working with the County of Lambton's library system to help people print off their vaccine status if they can't do it themselves. They can also get it through and download it themselves through a provincial portal. Or they can call here at the health unit if they're having problems. Some people don't have the green. You need your card, your health card, your date of birth, and your postal code. Some people don't have that. If they've got a red card, they don't have a health card. There's a way around that. They can call us at the health unit. We can help them set that up. And as I say, we're quite flexible. We will take walk-ins where we can. So there'll be other walk-in clinics that will be on our websites. We did have a successful walk-in clinic at Great Lakes Secondary School. We've got 144 people come into that, and 100 of them with first doses. There'll be other work done with pop-up clinics. we're working, trying to clarify with businesses requirements for the mandatory, for the vaccine passports. We think this will help get our immunization rates up, but will help businesses, well, will avoid, I can't promise, but we hope to avoid a fourth shutdown and another lockdown, which will be an unhappy state for all of us. So that would be my report, Mr. Chairman.
Thank you. I'll open up the floor for questions. Councillor Bird.
Thank you. Through the chair to Dr. Greensmith. So this is sort of a statement, and I would like, please, your response to this. So to be always keeping as aware and informed as I can, I signed on with many universities to be on their distribution list to get the latest sort of technical, scientific, medical research, etc. So according to their, including Stanford and Cornell and other universities, according to their reports, they're saying, and I would really like your thoughts on this, but they're saying that out of 1,500 test results, they've found no evidence of COVID-19, only influenza A and B, no isolated and purified samples of COVID-19 yet at all, not even from the CDC. And they're saying that most deaths recorded are flu on top of comorbidities, which of course weakens the immune system. I know that they isolated SARS-CoV-2, but that was 17 years ago and it wasn't the same strain as COVID-19. So one would think after all this time that there was a viable sample in the world. What are your comments, please, on this, on these results?
Well, I don't know what their samples, where they took their sample from. We obviously had COVID circulating, and in their sample size they didn't find it, and they found some influenza. Well, influenza does travel around the world at different times of the year. What we have been worried about is what will influenza do to us this year. The experience in Australia is that that's been very low. We still want people to get vaccinated with influenza vaccines this year. We're hoping for a low prevalence for that. I can't explain their data, why they didn't find any COVID. But we've certainly got it here. We can see our confirmed cases on a daily basis, and across the province, we're running 500 to 600 confirmed cases of COVID, so it's here.
So if I can just finish with, do you have any evidence that you can provide to the public? And, you know, all the other people are reading these reports too. So, you know, I'm always getting calls from constituents. So I wonder if there's anything that you can offer in the way of proof that you actually have an isolated and purified sample of COVID-19, just at least one. Is there anything that you can offer us?
I can only offer the data I've given you, which comes from provincial sources and national sources, that we have COVID-19 circulating in our community and the Delta variant, which has been isolated.
So locally, where can we reference, like where can we see this actual proof in our county or country or province even? Is there somewhere that you could refer us to, please?
I would refer you to our website or the provincial website, so I'm not sure what level of proof you're seeking, but we have to go with the data we've provided and the laboratory reports we receive as a health unit and as individual practitioners here.
Okay, thank you.
Councillor Bradley, do you have a question?
I have a question and a comment. Dr. Greensmith, my understanding was those 69 confirmed deaths in Lambton County were all confirmed as COVID or COVID related. And I appreciate what you're saying, and you're new in this position for a short period of time. Two things. One is, do you have a breakdown on the latest numbers on vaccinated versus unvaccinated, whoever's contacted COVID?
I think the province is starting to put that number out here. Our numbers are relatively small in Lambton at the moment. We would anticipate some vaccine breakthrough. It's not our policy to publish those when we have numbers less than 5, because somebody might be able to identify the patient. So yes, there's a call for that. this is likely, and I can tell you in broad terms that, and I think I'm probably quoting from the Global Mail here, that if there's 145 patients in, I shouldn't use the numbers, but if most of the 90% of the patients in intensive care are unvaccinated, and maybe a few small percentage are vaccinated. So it's in that order of magnitude. The vaccine protects you from severe illness and death and the consequences. It is still possible to have breakthrough infections, especially with this later variant, but the vaccine is still highly protective.
This is either to you or to county staff. When will the county be adopting for their staff, not the political people, that's a separate issue. When will the county be adopting, similar to the city, a vaccine policy?
Yes.
Yesterday. I think it's been released already for staff.
That's correct.
Stefan's there. Oh, no, Mr. Taylor's here. He's telling me it's gone
Yeah.
yesterday, and I'm not sure where the county council is, but.
Okay, so that policy now is in place for the county, Mr. Tebow, for Mr. Taylor?
Yes, I can address that if I may, Chair Ramos.
Yes, please.
Thank you. So the short answer is that the policy is in effect for all of our employees, students, and volunteers effective as of yesterday. It was widely distributed yesterday morning at about 9 a.m. But prior to doing that, as I mentioned in prior committee meetings and council meetings, the county did a survey of all of its employees to ascertain sort of vaccination rates back in July. We got the results of that in August, and we communicated in late August the results of that survey. And in late August, we also communicated to employees at that point in time that they were strongly urged to get vaccinated against COVID-19, and that we would be following that up with further information on a policy. And that policy was released yesterday, September 14th.
Okay. Is that, I don't recall seeing that policy being sent to county council, was it, or I missed it?
It may not have been sent. We can send it out to
Sure.
county policy or to county council.
That would be appreciated. Thank you very much. Thank you.
Welcome.
Any other questions? Councillor Weber.
I guess I would hope that our policy for staff would be the same for elected officials. I don't think that if we're reacting with staff that we should impose something on our staff that we wouldn't accept ourselves as councillors. So just I don't know when that comes back, whether that comes to council, whether we have to make a decision on that. But I would certainly support whatever's good for the staff is good for the councillors.
Councillor Bradley.
Yeah, Mayor Weber, there is a motion coming from City Council that was passed on Monday that will address that and at least put it on the floor for discussion.
Thank you.
All right. Any other questions for Dr. Greensmith?
Madam Chair, if I may, we have a report going to council on October 6th with respect to member vaccination. And the reason it's going to council on October 6th directly from staff is that the issue needs to be assessed from a health and safety perspective. And that, of course, will be your decision at the end of the day. And for that reason, we took those steps to actively bring the issue to your attention. So there will be a report both in open session and in closed session dealing with the legalities of the vaccination policy for council's consideration on October 6th.
Thank you for that clarification. We look forward to reading that report. Any other questions? Seeing none, I'll thank our members from Lambton Public Health for attending today and for that update. Wish you a good week.
Thank you.
Take care. All right, we are going to move on to the Infrastructure and Development Services Division. We have an information report that needs a motion to receive and file. Moved by Councillor Weber, seconded by Councillor Hand. Any questions or comments on that report? All in favor of receiving and filing that? That is carried. Thank you. There's a report requiring a motion here. Do we have a mover and a seconder to have that put on the floor? Warden Marriott, and seconded by Councillor Napper. Thank you. Any questions or comments on that report? Seeing none, all in favor? That is carried. Is there any other business? Okay, we will move on to the, oh, sorry, Councillor Napper. Councillor
Yes,
Napper.
thank you very much. I would just like to pass on to Mr. Coles and the staff over for the quick response they made on the complaint that I made on County Road 7, I believe it is, on Forest Town line there. And that was very quick action, and the people out there in my municipality certainly appreciated it. So thank you very much for the quick action on that.
Yes, thank you for that comment, Councillor Napper. I know the people in our municipality were very grateful for the quick response as well. Thank you, Mr. Cole. Have a good day. And we will go on to the Public Health Services Division. There are a few correspondence to receive and file. We want to make that one motion. Councillor Weber, and seconded by Councillor Miller. Any questions or anything we want to highlight on those today? All in favor of receiving and filing those correspondence? Thank you. And information reports. There are two. Do we want to deal with those separately or together? Councillor Bird.
Thank you, Chair, on that. I'd just like to make a comment on the first one, the information.
We do need a mover and a seconder to speak to the report. We'll do them separately. Do we have a mover and a seconder to speak to that report, to receive and file? Councillor Weber and Warden Marriott. Thank you. Go ahead, Councillor Bird.
Yeah. No, I just want to make a comment that, and publicly, so that it's on the public record, I'm really concerned about this anti-vaccination. I've mentioned this at Monday's meeting, but I think we have to be really careful how these edicts come out, because councillors, let's just be clear for the public here, we are not employees, we're elected officials, and as such, we don't have an employer. We work for the people pay for us. Therefore, we should not be getting any kind of edict or instruction from government agencies telling us what to do. We work to the people, we respond for the people. So I just wanted to make that very clear. I'm really upset about us being, as elected officials, being included with everybody at large. We do not work for anybody except the people. So thank you.
Okay. Any other comments on that report? All in favor of receiving and filing that report? That is carried. And we'll move on to the Food Safety Program Update Report. We need a motion to receive and file that. Thank you, Councillor Miller and Councillor Bird. Questions or comments on that report? All in favor? That is carried. There are no emergency medical services on the agenda today. And is there any other business, Mr. Taylor?
Nothing else for public health, thank you.
Okay, thank you. We will move on to Cultural Services Division. There's two information reports there. Need a mover and a seconder to receive and file those. Councillor Bird and Councillor Miller. And are you, Councillor Bird, wanting to receive and file both of those together? Is that okay?
Yes, it is. Thank you.
Thank you for that clarification. And any questions or comments on those reports? All in favor of receiving and filing those? That is carried. And we have two reports requiring a motion. The first one is regarding library's donation report. We need a mover and a seconder for that report. Thank you, Councillor Hand and Councillor Napper. Any questions or comments on that? All in favor of the recommendation? Oh, thank you. And the second report is the collections management report. We need a mover and a seconder for that recommendation. Thank you, Councillor Weber and Councillor Hand. Questions or comments on that? All in favor of that recommendation? That is carried. Is there any other business, Mr. Meyer?
None for me, Madam Chair. Thank you.
Thank you very much. All right, Councillor Weber.
I guess just a question through to Mr. Meyer regarding Paint Ontario. I know it's open now. How is that going? Is the numbers up on that? They've got some outside exhibits and it's quite, I invite everyone to come up to the museum and see that. I think there's still appointments being made of a time slot. So can Mr. Meyer could comment on that? I'd be pleased.
Yes, through the chair, and thank you for the opportunity, Councillor Weber. It's been tremendously successful, despite the need for time-ticketed entry. I was speaking with the curator just yesterday, and she mentioned this past weekend, for example, there was over 150 people through. And we've had very good turnout over the last few weeks. So residents had an opportunity to come and see it until Sunday, September the 26th. So yes, I would encourage folks to get out and have a look. There's some incredible artwork on display, and the sales go to support cultural development in the community. So if you haven't had an opportunity, please do come out and take in Paint Ontario.
Thank you, Councillor Weber, for that reminder. And we have no in-camera today, so we just need a motion to adjourn. Moved by Councillor Miller, seconded by Councillor Bradley. All in favor? Thank you very much. Have a good day.